Started in 1965, the Head Start program is designed on the ecological model of Bronfenbrenner and strives to evaluate and promote human development as a complex interrelationship between the child, the family, and the community. The U.S. Department of Health and Human Services oversees the administration of the Head Start programs. Head Start is described as a comprehensive educational program for low-income children with a focus on school readiness. Head Start is funded at the federal level with grants provided to the communities. The target population is low-income children, foster children, and homeless children from age birth through age 5. A Head Start program may also include services for low-income pregnant mothers. Early Head Start is for children from birth to age 3, and Head Start is for children ages 4 and 5. The federal Head Start program has the following mission statement. Head Start promotes school readiness of children under 5 from low-income families through education, health, social, and other services. Income limits are based on the Health and Human Service Poverty Guidelines and are updated each year. Each community can determine if a Head Start program would be beneficial. Most programs are collaborative between the public school system and a community organization. The Brazos Valley Head Start in My Community is a collaborative venture between multiple school districts and the Brazos Valley Community Action Agency. Brazos Valley Head Start serves the 7 counties of the Brazos Valley with 7 child development centers and 1 early Head Start facility that also provides support to low-income pregnant women. For the purpose of this program evaluation and modification, the CDC in Bryan, Brazos County, Texas, will be the focus. Geographically, Brazos County is 591 square miles with a population of 223,000. The program allows for up to 10% of the students to meet high-risk criteria and be exempted from the low-income guidelines. According to Lee and Ledlington, participation in Head Start has been associated with positive outcomes for children who have experienced violence in their home or community. They further explain that children and families that experience violence are at a higher risk for negative social emotional outcomes. Participation in Head Start has demonstrated an ability to mediate the poor social and emotional outcomes by applying a strength-based approach and by encouraging children as they develop trust, independence, self-control, and a respect for others. Using this evidence-based research, the goals of the program and the implementation are appropriate for the targeted population. Developmental theory has established the importance of friendships, peer relations, group norms, and school settings as critical factors in human development. This belief is integral to the prevention of isolation and limited access to resources and support often found in low-income families who usually cluster in low-income areas. Head Start is founded on the ecological theory and the bidirectional interactions between the child and the layers of the system. From the microsystem to the macrosystem, Head Start acknowledges the role of the family, the community, and the government policy. Developmental theory has established the importance of each level and the interrelatedness and impact not only as critical factors in development, but also as mediating the risk factors of maladaptive development. Head Start implements ideas and concepts from most of the developmentalists. From Piaget, the concept of sensory motor and pre-operational stages guide the early Head Start curriculum. Parents are taught to monitor, interpret, and respond to sounds and gestures. Providing education to the parents regarding the stages and tasks helps decrease the stress and anxiety of having a newborn and may prevent abuse and neglect as expectations in early childhood development is explained. From Erickson and Bowlby, Head Start focuses on building trust, fostering attachment, and encouraging parents to be consistent, positive, and reinforcing. The reliability and quality of this relationship will facilitate the Ericksonian stage of trust versus mistrust. The Head Start concept is to move away from basic child survival and focus on optimal child development. Bowlby presents the need to acknowledge temperament and its role in attachment. Many of the students who attend Head Start may have experienced parental rejection due to abandonment, multiple caregivers, incarceration, or foster care. Providing parents education regarding the Ericksonian task and attachment theory can be beneficial regarding different types of attachment and ways to facilitate secure attachment. From Kohlberg and Vygotsky, Head Start looks at cognitive development. From Kohlberg, Head Start understands and works from the moral concept of the children under the age of 5 are at the pre-conventional stage and believe that rules are fixed and inflexible. Therefore, clear routines, schedules, and clear, attainable, age-appropriate expectations are provided. This feeds into the influence of culture as noted by Vygotsky. Head Start aligns with this theory in the belief that learning is most effective and efficient when children play in a secure, organized environment. The creation of safe community in which to learn circles back to the ecological theory on which the overall program is based. For my community, I support the mission and goals of Head Start. The Brazos County Head Start program includes access to health and dental care, a 2-Thursday educational program with nutritious family-style meals, and a 2-visit in-home educational program focused on parents and parental competency. The goal of the Head Start of the Brazos Valley is to provide each child and parent opportunities to view themselves as competent and successful. Additional programmatic provisions include the fostering of beloved learning, learning through discovery and play, and learning through both teacher-directed and independent centers and activities. Children who have attended Head Start have demonstrated better outcomes in reading and math and had fewer behavior problems than those who did not attend the program. It's important to note that both academic readiness and social readiness are needed for success in school. There are 2 sections of the Brazos Valley Head Start that I would modify. The first modification would be to extend the hours. Current program operates from 8:30 a.m. until 2:30 p.m. This time schedule does not allow parents who work to drop off children before work or have a way to pick them up. I would change the time of arrival to 7:30 and have daycare staff available to provide breakfast and supervision until a start time of 8:30. Additionally, parents who are working would be able to elect an after-school program that would provide extended daycare until 5:30 p.m. I believe this program change would be developmentally appropriate for adults and children, as it would assist the parents in their ability to provide for their children, maintain employment, model employment, and achieve the Ericksonian goals of being useful and productive. Additionally, as more and more social support programs have work requirements, a parent would be unable to work, maintain their benefits, and have a child in Head Start. The second section that I would modify would be the issue regarding transportation. Brazos Valley Head Start does not currently provide transportation, and there is also a policy that a child can only have 3 non-medical excused absences before being dropped from the program. Understanding that low-income families struggle with housing, transportation, and medical care, I believe the school district should provide free door-to-door transportation for children in the 4 and 5 age group of Head Start. This would ensure that transportation is not a barrier to their Head Start education. Evidence to support the need for both better times and transportation is based on retention and the ability for more students to attend. Lee states that the positive effects of longer enrollment duration were greater for children with more family risk and for those with lower academic scores upon enrollment. She further discusses that students who were enrolled and attended Head Start for 2 consecutive years had higher scores than children who only attended for 1 year. Attrition rates are high for Head Start as relocation, housing, and transportation issues are significant barriers to stability and education. Disruptions in the participation of Head Start could be mediated by transportation and extended times. Since 1965, the benefit of providing extra help and support for low-income, at-risk children has proven to be an effective way to improve school readiness. The goal of working on both social skills and academic skills enhances school readiness, and with a quality transition program, can aid in allowing Head Start to change the trajectory of education for many low-income students. Research indicates and supports that Head Start and Early Head Start are cost-effective interventions that promote social and academic readiness for low-income children and their families.